Welcome to 3x5 News, Views, and Reviews. Scribble on index card. We get in and we get out fast, so keep up. Health insurance is beginning to seem less like a right than a prize, with a deductible free plan the gold cup. One belief that, for many Republicans, justified Medicaid cuts in Trump's recent big but ugly bill, reports the New York Times, is, quote, that health insurance coverage isn't actually an essential benefit. Let me repeat that. That health insurance coverage isn't actually an essential benefit. Huh? What could that possibly mean? The Times reports on one source, edited. Recently, quote, the influential Paragon Institute published a paper titled, What Matters for Health? Insurance is less important than you think. Paragon was elevating the idea that people won't face much harm if they lose medical coverage, unquote. When I first read this, I couldn't see where they were going with it. Everybody has to go to the doctor, and every doctor and hospital has to be paid. Were they suggesting not seeing doctors and just going to some wellness seminar hosted by Robert F. Kennedy Jr., complete with goat yoga? Or were they suggesting seeking out free healthcare? The Times continues, open quote. There are now about 15,000 federally funded clinics that help serve the poor and uninsured, unquote. Robert Rector, a research fellow at Extreme Right Heritage Foundation, said that the people who lose health insurance, open quote, can walk into those facilities and receive totally free primary care and some secondary care, absolutely for free, unquote. Yes, we get it, free, except it's not. More on that in a moment. Conservatives also point to emergency rooms, already the de facto health care for the poor. ERs are required to treat anyone, even those who have no insurance. Never mind the small complication of head exploding ER bills. And once the collections process is exhausted, your paycheck being garnished. And when they aren't paid, hospitals pass along the extra costs to paying customers. Also, returning to the clinics, they are not free for everyone, but charge on a sliding scale, which doesn't much help people who must pay out of pocket when there is little in their pockets. And where do prescriptions, operations, and home health care fit into this brave new health insurance-free future? They also kind of forgot to factor in what happens when the 10.9 million people projected to lose Medicaid under the big but ugly bill suddenly show up at the doors of the clinics. Who really believes the federal government, after cutting Medicaid, will be inclined to accommodate the influx and pay for the expansion of the clinics? Nor are they likely to fund the bring out your dead wagons that will prowl our streets in search of the bodies of those who, lacking access to clinics and fearful of the cost of the emergency room, just die at home. I would be remiss if I forgot to mention the one problem conservatives always forget to factor in when it comes to Medicaid cuts. It's not difficult to imagine the newly uninsured poor relations, as they used to call them, of successful congresspersons, appealing to them to help pay for prescriptions, operations, home health care apparatus, etc. Imagine the wife of a congressperson, excuse the stereotyping, saying to her husband, my brother needs insulin and my father needs heart valve surgery. We have to help them, unquote. With the effects of the big but ugly bill hitting home, he thinks, oh, what did we do? And to think, Republicans present this stuff with a straight face.